Welcome back to Tales from the Lab, a veterinary podcast. As you may have noticed, we've made some exciting changes around here. I am your new co-host, Dr. Brad Ryan, Senior Professional Services Veterinarian at Antech Diagnostics.
And I'm Dr. Holly Brown, a clinical pathologist and Chief Veterinary Educator at Antech. Together, we'll be discussing real patients and bring in expert guests to offer deeper insights into the laboratory diagnostics used to solve interesting and challenging cases.
Tales from the Lab is a production of Antech Diagnostics. The intent of this podcast is to provide education and guidance with the understanding that any diagnostic testing and treatment decisions are ultimately at the discretion of the attending veterinarian within the established veterinarian-patient-client relationship.
Just a quick note before we jump into today's episode. Dr. Marika Constantaras is employed by Antech and Mars Next Generation Technologies. We're sharing this so you have full transparency about the relationships involved.
Today, we're joined by Dr. Marika Constantaras. She's a board-certified veterinary dentist who leads the teledentistry services at Antech, and she's played a key role in developing RapidRead Dental, which is an AI-based tool for dental radiograph interpretation.
Marika is also a hospital director at a specialty veterinary hospital. She works closely with the Mars Next Generation Technologies group on AI development and is a diplomate of the American Veterinary Dental College. Marika, thanks so much for being here, especially at this early hour. She's joining us from the sunny state of Hawaii. Good morning to you.
Good morning. It is actually starting to get light out. It's about 7 o'clock here. Beautiful day as usual, and I'm very happy to be part of this. I was saying earlier that I can talk about dentistry all day long, so you'll have to cut me off at some point.
We have a lot of great questions for you today, but before we dive into those, could we just start with setting the table with explain to our listeners exactly what is RapidRead Dental?
Great question. So RapidRead Dental is an artificial intelligence-based tool. It's a context-aware, deep learning AI system that detects dental pathologies on a tooth-by-tooth system by analyzing the entire radiograph. So one of the nice things about RapidRead Dental, hence the name RapidRead, is that you get that report within 10 minutes while the patient is still under anesthesia.
I enjoyed listening to your webinar that you delivered last month, and in particular, your frame of reference, in that you speak of currently how we're doing radiographs and the advanced technology that we use around dental radiography, but you framed it from your perspective of where you started out taking dental radiographs on films with fixed x-ray arms, hand developing everything. I thought that was an interesting perspective, and I thought maybe you could help our listeners understand what problems in everyday dental practice RapidRead Dental helps to solve most effectively, and the use of AI and how that helps in a pivotal moment for veterinary dentistry.
Yeah, it's funny. When I graduated veterinary school, I knew absolutely nothing about dentistry. I didn't even realize that cats really had teeth. It was really sad. So I had the personality where I just wanted to learn everything about everything, and I was doing a lot of dentistry procedures. We all know in general practice, we do tons of dentistry procedures. And I started shadowing the veterinary dentist in my area. And on my days off, I would go and I'd hang out with her. And I was just amazed about how much disease there was. And I said, well, we're not recognizing this because we didn't have dental radiographs at our practice. I said, okay, how do we do this? And I said, went to my bosses and I said, let's get dental radiographs. And they said, nope, too expensive. And I said, I'll prove it to you. So I went and I practiced, figured out with film how to get images that were diagnostic using just the regular dental x-ray. We'd haul our patients from the dental room over to x-ray, take our dental radiographs, hand develop them, and we showed so much pathology. We found so much disease. We were able to help these patients. And just taking those steps, I don't want anybody else to have to work that hard to make a difference in our pets' lives. And so one of the things that was really important when we were developing this RapidRead Dental, they approached me and said, hey, are you interested in working on this? And I said, absolutely. I would love to spend my spare time doing this project because I think it will be so useful for people to be able to have a tool where they can recognize disease by having somebody over their shoulder. Now, it can't be a veterinary dentist like I did where I shadowed somebody, right? But it's the next best thing. And just having that ability to give people the tools to make their jobs easier is really, really rewarding. And I'm really excited about this product.
Yeah. So I know from my time in the field as a professional services veterinarian, speaking to veterinarians about artificial intelligence, AI, it really, we're in this rapidly changing world where AI is becoming increasingly pervasive in our society. We have a lot of mixed emotions, I think, not just as veterinarians, but in society at large. And you spend a lot of time talking about what AI actually means. So moving beyond that buzzword that sometimes gets people freaked out, and really try to emphasize the practical meaning of AI in this context. So for all of our listeners, I would like you to, if you could, give us a short version of the difference between AI, machine learning, deep learning, and why the transformer approach matters for dental radiographs.
Yeah, I mean, it's kind of similar to how I started with not knowing anything about teeth when I graduated veterinary school, right? I started this project with Mars, and I had absolutely no knowledge of any AI products or how to train them. So it was a huge learning curve for me. And I just, going through that process, I really appreciated the differences. The data scientists have their opinions, and they're talking about how we can do different things. And I'm saying, well, this is what we need as practitioners, and how do those things merge? And I think the terminology, just understanding that is really important so that you can assess whether a tool, and there's a million tools out there, whether it's useful, right? Whether it makes a meaningful difference in your practice or not. And so AI, right, is just a machine that does something that humans do, right? Super simple. But then there's different categories of it. Machine learning is nice because it learns over time. There's different types of machine learning, how you train something where you can either label images, and over time it says, okay, I gotcha. Like this is a tooth, this is not a tooth, like thumbs up. Or, you throw a bunch of stuff at it and it says over time, okay, yes, like I get it. These are probably something that I should focus on. This is different from that. And so there's all different kinds of machine learning. But then I think the real benefit of having this product with Mars is because they have such a huge computing power. They have such really brilliant data scientists. So we were able to use, I think it's really important that we were able to use something called deep learning, which I had no idea was different. But there's a series of neural networks, and it's as you go through the process within this deep learning system, each neural network learns from what it learned previously. So it builds on each other, and it learns autonomously, and it makes changes autonomously. And then transformers is kind of the next latest and greatest, where it looks at the entire image and uses context clues to figure things out, which is exactly how we look at an image, right? We don't just look at a very specific part of a tooth and say, oh, that's what this is, right? We look at the entire image. Is it the maxilla? Is it the mandible? What tooth? Is it a cat? Is it a dog? What are we looking at? How does the bone loss affect? Okay, we've got some root resorption here. Is there actually tooth resorption? So going through that process of how people are looking at a radiograph is the same way transformers use the training for looking at a dental radiograph. So I think that's really valuable to understand the differences, just because there are going to be so many products, and there are so many products out there. Having some sort of idea of what you're looking at and how things were trained, I think, is important.
Yeah, thanks for that insight, because I think you bring such a great perspective to our listeners, because we're all in the veterinary space and not in the AI space, right? So it's really helpful for us to hear through your lens, right, how you've been able to understand these networks and that neural network and the deep learning component of it. Because as you said, it's not just recognizing a lesion, right? It's going beyond that, right? Orienting ourselves within the mouth, and then getting these procedural radiographs, right? With this detailed review of each aspect of each tooth, right? That provides so much information during a procedure, right? I imagine this is so helpful to our clinicians and our technicians performing these dentistries, rather than getting radiographs afterward or getting them reviewed afterward, getting feedback in the middle of a procedure, right, can help guide their next steps. Can you speak to that?
Absolutely. And I think that's how it's nice that there was such a collaboration between a veterinary dentist and the data scientist team, is that we wanted this product to be useful. We wanted it to be something that people could use. And so instead of just analyzing an image and saying what's on the image, we used all of these deep learning systems and transformers to identify individual teeth, to identify individual roots, and then make a diagnosis for each tooth, because that's how we practice, right? We don't say, well, what am I going to do about this image? We say, well, what am I going to do about this tooth, right? And so that is a big difference in how we structured this product, because we wanted it to be useful for people.
When AI enters diagnostics, accuracy is always top of mind, of course. In the webinar, you always emphasize, of course, the fact that RapidRead Dental has been built off of tens of thousands of radiographs, hundreds of thousands of teeth, years of development. And of course, any type of statistical algorithm, right, is only as accurate as the amount of data that's been put into the system. And obviously, we've met a very high bar here. So can you walk us through how RapidRead Dental was trained, how it was validated and quality monitored? And what would you like veterinarians to understand about sensitivity, specificity, and the difference between released and unreleased findings with RapidRead Dental?
Yeah, I think that's really important, because there are so many products out there and you want to be able to rely on them, right? If you're going to use the tool, is it actually going to make a difference in how you practice? Or is it you use the tool and it's to your detriment because it's giving you wrong information? So having all of those metrics is really important to making sure that we're delivering a product that is actually going to be useful. Because our ultimate goal is to help patients, right? And so one of the things that we did is we used reports that were structured on a tooth-by-tooth basis. So we had 10 years of reports that we were able to draw from, and the associated images. So we had that wealth of data. In addition to that, we had a group of veterinary dentists who went through and labeled images and validated images. And I am really picky. The head data scientist at Mars, Fernando Jr., is super, super picky. So between the two of us, we are extremely picky about what we let slide. So we would look at not only the overall picture, but we look at the metrics for each individual tooth and then each individual pathology for each individual tooth. So, okay, how are the incisors doing for horizontal bone loss? How is the mandibular first molar doing for tooth resorption, right? And what are the false positive rate? What is the false negative rate? What's our prevalence, right? So all of these metrics would go into it. And then also validating it on images that are obtained in the wild, right? So my images, I've been doing this for years and years and years. So my images are going to be mostly diagnostic, right? I delete the ones that are non-diagnostic. But, mostly what we feed into it is going to be diagnostic. And as general practitioners, I remember my images there's a steep learning curve, right? And we want this product to be available to everybody. So one of the things that we looked at was, well, what's an image that's diagnostic versus not diagnostic? And the images, what is the cutoff where we can reasonably expect that the product is going to give a good result? And then we had a cutoff, right? So we said, if the image isn't up to a standard where it's going to give a very good, accurate result, we're not even going to look at that image, because we don't want to give false information. So that's one of the things that we looked at, is whether an image is non-diagnostic or diagnostic before even giving a report for that particular tooth.
Yeah, that sounds fantastic. There's so much training and expertise gone into the project and the ultimate product of RapidRead Dental. And can you talk about how ongoing overreads fit into maintaining the quality over time?
So there shouldn't be any changes in the quality over time, but we're always making improvements, right? The more data we get, the more different cases that we get, the more pathologies we get. We're looking at the prevalence for all the different pathologies, and we started off with the pathologies that are most common and working our way through the least common. But we're looking at all of the different pathologies and doing oversight for the images that are coming through, to see how are people using the product? How is it? What is the accuracy? Making sure that isn't changing over time for whatever reason. Are people getting new machines? Are people using different types of techniques? Whatever it is. So that's an ongoing process with any AI product. That's really, really important. But then also to develop new training data, right? All of this data that we're getting, we can determine, what would be most useful, right? We're finding a lot of dentigerous cysts, which the product right now doesn't identify dentigerous cysts. So, what is going to be most useful? So that ongoing oversight is really important for that reason as well.
Can you talk to us, being involved in dentals on a daily basis, right? And having been doing this for so many years, can you talk about the procedural flow and, practically speaking, when the patient's under anesthesia, when do they take the images? When do they integrate RapidRead into that, in addition to their probing and charting, et cetera?
Yeah, so there's the ideal world, and then there's the realistic world, right? So ideally, what would happen is your patient is under anesthesia. You take your dental radiographs on one side, you flip to the other side if you're doing your images in lateral, flip to the other side, take your images and submit all of those as one study for RapidRead review. As that is marinating in its various channels, then you have your technician cleaning, probing, charting, and the veterinarian is reviewing those dental radiographs and then reviewing the results of the dental charting. And as part of that review, they have a report that comes back within 10 minutes. And they can take that information and use that as a tool to help them make decisions about how to treat their patient. So I think this is a really important tool. This product does not make a diagnosis for the veterinarian. The veterinarian is still is critical in using all of the information, including the report from RapidRead Dental, in making a decision, a diagnosis, and a treatment plan. So our goal for this product is that by the time the patient's done with their cleaning and probing and charting and x-rays, that the veterinarian has a plan. Right? They can take the RapidRead Dental report and they can take their images and they can go back to their dental chart and they can say with confidence, yes, this is a tooth that's healthy, or yes, this is a tooth that needs treatment, and proceed right there. So it speeds up the workflow. It makes everybody more confident. And it also helps to prevent missing a diagnosis, right? We don't want to miss lesions. That's the most important thing. If you extract an incisor that didn't need to be extracted, no big deal. But say you didn't extract an incisor and it turns out to be a big old radicular cyst at some point, you're going to be kicking yourself, right? So one of the benefits of using this as a tool is that you can go back and double check and make sure you're not missing any pathology.
Yeah, and doing that while the patient's under anesthesia, right? During this one procedure.
Exactly.
Yeah, I love it.
Exactly. Yeah, it's hard enough to get a patient in the door one time for a dentistry procedure, right? How are you going to talk them into coming in 2 weeks later for another dentistry procedure to extract those teeth that that need to come out if you didn't have that RapidRead Dental report? And ideally, everybody would have phone a friend veterinary dentist, right, on their phone and say, hey, can you look at this image? I'm going to text you this radiograph. Can you tell me if you think this is a problem or not, right? That would be great. I would love to be able to do that for everybody, as would every veterinary dentist. Absolutely. But that's just impractical. There's no way that can happen. So this RapidRead Dental is kind of that phone a friend, right? Here's what I think. What is RapidRead Dental? You put that information together and you hopefully make good decisions for your patient.
I wanted to circle back to what we were talking about earlier about images that get thrown out, non-diagnostic images, the importance of positioning. So, Marika, what are the most common reasons that an image would get labeled as non-diagnostic, and what are the key positioning requirements veterinarians need to be focused on to make sure that they're getting the most value out of RapidRead Dental?
Yeah, very, very important. The data that you receive is only as good as the image that you provide. And so the way we trained it is if I looked at an image and I couldn't tell you if there was pathology or not, then we can't expect a AI product to decide whether there's pathology or not. And so those images get thrown out. So a big reason is foreshortening. So if the image is foreshortened, the crown is superimposed over the roots, you can't see the bone, you can't see the roots, you can't see the crown, you're not going to get any information from that. And so those images are thrown out. We did compile a training tool that's available to everybody who signs up for RapidRead Dental. And it's a positioning guide. Here's how to position. And there's an easy way to do it without the bisecting angle technique, which, if that makes sense to you, awesome. If it doesn't, there's a tool to help you get good positioning just based on the dial on your radiograph machine and how to position them. But I think that's the most important thing to recognize. If you're not taking good quality images, you're not going to get good quality results. It doesn't matter who's looking at the image. I think the other big part of it is not including enough context. So if your plate is not actually next to the teeth that are imaged and you're just imaging air mostly, and you've got a little bit of the tooth in there, it's really difficult to understand context, right? So the transformers look at the entire image. If 90% of the image is black, it's really hard to get context. So you might know what you're looking at because you're the one who took the image. So you know that's, the mandibular premolars, but just looking at the image, it's almost impossible to tell. Not that it can't, but we've looked at the metrics for images like that. And if those metrics don't meet our threshold for accuracy, then that's why it's thrown out, because there's a greater likelihood that it's going to be wrong when the image isn't diagnostic. So I think that's really important. And it also gives you the opportunity to retake that image, because it'll have on that report, image not analyzed because of it's not diagnostic. And so you can look at that image and say, oh yeah, okay, that makes sense. And then you can retake the image and make it more diagnostic right then and there, instead of having to get the patient back under anesthesia.
So there are limitations, obviously, when we don't have quality radiographs submitted. Are there other limitations to RapidRead Dental that our clinicians should be aware of?
Yes, it is not making a diagnosis. I think that's the most important thing to recognize. It's a tool, right? The same way, if your ECG flatlines, you're not going to throw out the ECG because your patient is clearly still has a heart rate, right? You're going to be like, oh, the leads came off, or the leads are dry, right? How do I troubleshoot this? Oh, my patient's breathing. It's probably not flatlined, right? So same thing for any tool. You look at the tool and you look at your patient and you put those two pieces of information together to make a decision. So same thing, it might say that a tooth is missing. Well, maybe it's missing because you didn't image it, or it's at the very edge of the plate. And so again, we have cutoffs. If it's at the very edge of the plate, it's only partially imaged, we're going to discount it because we want to make sure that it's accurate. So using all the information available to the clinician is really important. So using it as a tool, not as a cut and dry diagnosis. I think that's very, very important. And that goes for any AI product, right? It's not designed to be a person. It's designed to help the person.
So, Marika, let's talk a little bit about when clinicians and AI RapidRead Dental are not in alignment. One of the most practical parts of your talk was the idea that clinicians can take these results and they can accept or reject those findings. So when a RapidRead result does not match the clinician's impression of what's going on, how should that disagreement be approached? What does a healthy AI clinician partnership look like in your mind?
Yeah, that's really important. One of the parts of the report is that we have guidelines for how to use the information. So for example, if there's a periapical lucency identified, we do the same sort of thing on the report that you would expect a clinician to do. Is there periodontitis? Is the tooth fractured? Is the tooth discolored? If yes, then that periapical lucency is more likely to be real. If the tooth is not discolored, it's not fractured, there's no periodontitis, everything else looks normal, then look at that periapical lucency and decide, well, maybe that's radiographic artifact, right? Is that a chevron effect? Now, we've trained for that, but you still need to make those decisions, right? It's identifying pathology, and then you take that information and you decide whether or not that is pathology that is the radiographic pathology is actually pathology associated with the tooth or if it's just an abnormality on the radiograph that is not actually clinically relevant. And so I think that's a really important thing to make sure that you do. Conversely, right, you might have missed the periapical lucency, right? You don't agree that there's a periapical lucency, and the rapid read report says there's a periapical lucency. And then you go back and look at the patient and you say, that tooth does look a little discolored. That actually, I agree with that. Absolutely. Let's take that tooth out, or let's do a root canal on that tooth, right? So making those connections between the patient and the radiograph report is really important, because again, our number one goal is we don't want to miss pathology. And so having that discrepancy is fine. You can take that discrepancy and you can decide what you're going to do about that discrepancy, either accept it or reject it based on all the information you have available, particularly the results of dental charting. I can't stress that enough. Looking at the patient, especially after you looked at the dental radiographs, go back and look at the patient again, right? Because you might have missed something. Oh, you know what? I didn't see that pocket on the palatal aspect. Now I do, right? Missed it the first time around, right? So all sorts of information back and forth. Or same thing, you can look at your dental chart and you can say, oh, it looks like there's a crown fracture. Let me look at that dental radiograph a little bit closer because I'm really looking for subtle changes, right? So going back and forth is really important.
You mentioned in the webinar that your favorite part of the report is actually the labeled color-coded images in that rapid read report. And how are you seeing clinics use these reports to improve their communication with the clients, building trust and treatment acceptance?
Yeah, those color-coded pictures are awesome, aren't they? You see that report, you see all those colors and you think, oh, that's going to be a lot of work, right? So red all over the place, long procedure, white, teeth labeled, no pathology, everybody does the happy dance. But it's also really nice for the client. You can print that out for the client, and it is a way to give them concrete information about the importance of dental radiographs, right? It's hard to say over the phone, right? You're calling them and you're saying, we took these dental radiographs and here's what we're finding, right? As opposed to, here's the report from last year. Take a look at these teeth, right? This is why we're doing these dental radiographs year after year. We're comparing, we're looking for this trend. We're looking to see what's happening with this tooth. This tooth is fractured. Last time it was, it was fine, but let's look at it again, right? It's just a really nice tool to be able to validate why we're taking dental radiographs. And I can go on and on and on about the benefits of dental radiographs, but the clients need to sometimes see that. And in picture form is one of the best ways that you can do that. It also shows them why you may have done a treatment, right? So your patient's under anesthesia, say, okay, it's going to be X number of dollars to take this tooth out. It's really important. The dental x-rays showed that this tooth is infected. We really need to take it out. And they say, okay, I trust you. And then you take the tooth out. And when you're discharging the patient, you review the report with the client and they say, oh my gosh, look at that tooth. I'm so glad you took that tooth out, right? It's a visual and it really builds trust with the veterinarian because they can see with their own eyes, which is what they need sometimes. They can see why you made the recommendations that you did and why, why it's important to take dental radiographs once a year. I think that's really important.
Marika, it's so interesting for me to hear you offer the perspective of a dentist and using these communication tools, because I'll say the same thing about lab work, right? As a clinical pathologist, being able to show the owner the lab work, right? A CBC is just 3 letters to them, right? Or a chemistry panel, right? It might be pretty abstract in thought, and trying to describe over the telephone why it's important to do these tests or what the results means can be really challenging. But showing them the results, letting them see where things are in the green or in the red, right? Why we need to investigate further, what concerns we have, and comparing it to previous lab work and saying the groundwork for the next diagnostics that will be done, either as a follow-up or the next year. It really looks really similar, the parallels, and I really appreciate hearing that.
Yeah, it's great. Isn't it nice when a client calls you up and says, hey, I think it's really time for my yearly lab work because last time we were worried about, this BUN. You said that I see this is a little higher than normal. Is it time to check it again, right? We want that for dentistry. I got this report. There are some client action items on there. I did all these things, but I know we were worried about this tooth in yellow. is it time for the next dentistry procedure, right? Absolutely, it would be amazing if every client were aware of the pathology, were aware of the need for dentistry procedures, both as a treatment and also a preventative measure, and then also, have that trust with the veterinarian that they're making decisions for their pet that are in the best interest because they have that visual representation of all the disease. I think would be amazing.
Why do you think feline dentistry is such an important next step for RapidRead Dental?
Most dentistry procedures statistically are done in dogs, but cats have so much pathology and they hide it so well, right? You never have a cat that comes in with facial swelling. You never have a cat that comes in with drooling because of dental disease. They continue to eat, they continue to live their lives, and yet there's so much disease, specifically tooth resorption, that these cats can have. And so again, having that RapidRead Dental for cats to identify tooth resorption, to have a way to show clients that there's tooth resorption, for looking at subtle tooth resorption, right? For looking at those teeth where you're saying, go back to that dental chart and check that tooth, right? There's a little lucency here. Make sure that's not early tooth resorption, I think is so important. Even though there's not a lot of feline patients going under anesthesia, I'm hoping that with the advent of RapidRead Dental for felines, that people will start to recognize that there's more disease and start to make recommendations for dentistry procedures in cats because they do a really good job of hiding their disease.
Yeah, that's true across the board. And I would say the same thing on the lab work, right? It's really interesting to hear those parallels. To close us out, what are one or two things you'd want veterinarians to remember about using RapidRead in practice?
Just one or two, huh? Okay.
Yep.
Let's see. I think the number one is to use it as a tool for every patient so that you can have a double check and make sure you're not missing pathology. I think that's a really important thing. I look at dental radiographs all the time and I miss lesions, right? It happens. And I go back to the last year and I said, oh my gosh, does this happen within a year? And I look back and I say, oh shoot, nope, it was there, right? I missed it, right? Ooh. And if I can do that, and I have had so much training in dentistry, I can't imagine how a general practitioner who has to learn everything from the nose to the tail and everything in between, and they're dealing with a million different things, it would be easy to miss pathology on dental radiographs when they're trying to get through procedures. So I think number one is if people can start using this as a tool for every patient and using it as a tool, I think that's the second big part, is not taking it for gospel. AI products are not a person, but incorporating the tool into your overall patient care and making decisions, incorporating all the information, including the RapidRead Dental report, I think would be my second biggest take home.
I love it. And to our listeners, if this episode has helped you think differently about dental radiographs and decision support tools, please share it with your teams. And we'll see you next time on Tales from the Lab. Listen to new episodes of Tales from the Lab wherever you get your podcasts. And now you can also watch us on YouTube and Spotify.
Be sure to like and subscribe for exciting new content. Share new episodes with your colleagues and follow us on Instagram at Tales from the Lab. That's TAILS from the Lab. We're grateful you're here.